Can eyelid surgery be done on dark skin prone to keloid scars?
People with dark skin, such as those of African, Hispanic, Mediterranean, and Asian descent, are often concerned about having eyelid surgery because of the possibility of undesirable scarring, such as scars referred to as keloids. Although it is well established that people with darker skin types are more prone to these types of scars, I can speak to how I approach upper and lower eyelid surgery for so-called ethnic skin types, like mine, in my practice. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I did my residency in ophthalmology in Brooklyn. I also worked as a division chief of oculoplastic surgery for many years in the same hospital after my oculoplastic surgery training. We served a community of mostly people of African heritage, as well as a large Hispanic and Caribbean population. During this time, I also became known for Asian eyelid surgery, both primary and revision surgery. Performing cosmetic eyelid surgery as well as a wide range of facial trauma-related surgeries, including lacerations and fractures, which provided me with the foundation of experience that inspired me to help my colleagues understand some important aspects to performing eyelid surgery in non-Caucasian patients. With this purpose in mind, I wrote an article titled Ethnic Considerations in Eyelid Surgery. To avoid scars, my first principle is, if you can avoid an incision, then do that. For example, my approach to lower eyelid surgery to reduce under-eye bags, regardless of skin color and skin type, is using the transconjunctival method. This means for a person who has puffy under-eye bags caused by fat pockets which have herniated forward, I perform the surgery from the inside of the eyelids, which means there are no external or outside incisions on the lower eyelid. My objective is to help you look like you never had eye bags or eyelid surgery. The art is to preserve the natural shape and character of the eyes. Upper eyelid surgery does require the removal of skin, which means an external incision is necessary as well as the placement of sutures. When it comes to upper eyelid surgery, there are also some more specific considerations for different ethnic groups. For example, in Asian eyelid surgery, the level of the crease and the options of non-incisional versus incisional, as well as the type of epicanthal fold and whether fat should be removed, makes this type of surgery a specialty area within my specialty practice. I have found that people who have the highest risk for keloid scarring still can have upper eyelid surgery performed safely. I explain to my patients with skin types ranging from light olive skin to dark brown skin that there are some things that are important to do to minimize the risk of undesirable scarring. The design of the upper eyelid skin removal is critical. We want to avoid an incision line which is obvious outside of the eyes when the eyes are open. The tension of the skin closure should be minimal, and the sutures and suture techniques are critical to creating a fine line well hidden inside the natural upper eyelid crease. I routinely perform both upper and lower eyelid surgery using local anesthesia with light intravenous or IV sedation, so patients are comfortable and can recover from surgery much faster than they would with general anesthesia. Typically, my patients return to work in about a week. In the early to mid-90s, I believed very strongly in making cosmetic eyelid surgery more accessible to everyone. Many people came to me feeling confident that as one of a very few specialists in oculoplastic surgery of Indian origin at that time in the tri-state area, that because of my own skin type, I would have some insight in the concerns of patients with darker skin. Certainly this had some validity, but my training and subsequent experience was the foundation to my approach to customizing eyelid surgery for all people, regardless of ethnicity. I hope you found this information helpful. Thank you for your question.